Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years, in our careers. There's a reason it's called practicing dentistry. All right, this week we are talking about time horizon. That's the best sort of label we could give this, but it's basically talking about, goal setting and aspirations for our careers and our personal lives. But dentists and longtime students, we all have this sort of timepiece associated with all of these goals, and trying to understand maybe what that looks like now that you get to set your own sort of speed and timeline for these goals. Have spent all of our formative years in these, 4 years of high school, 4 years of college, 4 years of dental school, some people with some sort of flexibility in there, but basically everything was running on this timeline. And I always joke that I had not thought past, residency, graduation. I had a plan: get to dental school, graduate dental school, 1 year residency, and then it was like,
what next?
Now what? What's your thoughts, Ronnetta?
So as I reflect on what you said, my first thought is Dr. Rice's book, Is Everyone Smiling But You? Level Up Your Life Practice. I think his book sums up this topic beautifully, in terms of talking about, where it is you see yourself and how to make that happen. And sometimes the how to make it happen is tough. And in addition to that, soul searching and figuring out what end game looks like, as you said, is tough. And it's one of those things that we'll likely have to do various times in our lives. As we hit different milestones, we set more goals. I think for me, what has changed is, for so long, like you said, we were in school. So the only real goals I had was, like you said, like professional goals, like, okay, make all A's in undergrad so I can get to dental school. And then once I'm in dental school, do really, really well so that if I want to specialize, I can. But if not, I could do a residency. And then the next thing became, okay, well, now I need to find a practice, and I need to try to do as well as I can in that practice so that I can learn as much as I can, so that if I want to become a practice owner, I have the tools and I have the speed and everything I need to become a practice owner. So we're in different stages of our time horizon. But, just earlier this year, I was talking to someone and they're like, okay, well, the goal was practice ownership for you. So like, what's next?
That's it.
Yeah. It's like,
wrap it up.
Is it? But then,
No.
I think you and I both know each other very well. So we're just like, okay, well, now from a professional standpoint, the goal is to grow the practice. But I don't know if it's because I'm aging and getting older and all those things, but now I just don't look at goals from a professional standpoint. I think about it from a personal and emotional and spiritual standpoint as well. And so having all of those goals coincide just helps propel, I think.
Yeah. Did you have a specific like time horizon, timed goal for practice ownership, or was it just more of when it felt right to you?
So I did have a time. I had a time limit.
Of course.
I did. I had a time limit. I met it before the time that I had in mind. Okay. But initially I didn't. A really close friend of mine that has been practicing, maybe 10 plus years more than me. I remember being in my associateship and just kind of wondering what I wanted to do. And his advice to me was to write down what my goals were and to give it a time limit and just work towards it. And for a long time in my associateship, working towards it was reading every leadership book that I could to become the best leader in that position that I could be, like
Yeah,
as an associate. Because, once you have the basic fundamentals, it can be applied to whether you're the owner or you're an associate, just in different ways.
for sure.
Um,
How do you feel comparison factors into all of this? Because I think we've definitely talked about in previous episodes, we were born and raised in a competitive environment of, you gotta get the grades in undergrad to get into dental school, and then you've gotta, they're even doing a GPR, there's some competition, but there's also competition just built into, not competition, comparison built
mhm.
into dental school. So how do you think that impacts setting these goals? And obviously you've been out a little bit longer, so has comparison sort of changed, or with your peers, with your friends, with your colleagues, what does that look like for you?
I think the best thing that ever happened to me was COVID happening, shutting
Yeah.
things down. Because that meant that we didn't meet face to face for dental meetings and that sort of thing. Um, and it wasn't until I was not meeting face to face with like some of my friends and colleagues that I had the opportunity to sit back and reflect and realize that subconsciously what I was doing when we would talk to each other at these dental meetings is judging myself and feeling like I should have been further along in some areas, or maybe I was further along in areas, but the areas you're further along in, you don't pay attention to that. You pay attention to where you feel
Yeah.
you're lacking.
Yeah.
And so
100%.
when dentistry shut down for a couple of months during COVID, I had the opportunity to sit and reflect and reframe the goals that I had for myself. And, those goals, I decided to put myself at the forefront in the path I felt I was going down, and focus on that and not so much focus on what my friends were doing or what other colleagues were doing. But at the same time, tap into mentors that were where I wanted to be.
Yeah.
But not so much look at it as competition or comparison, but look at it more so as motivation for, okay, if they did it, then I can too. And then, what I love about a lot of the mentors that I have is they share things they wish
How
they'd known or mistakes that they have made. And, you know, I just try to pull as much as I can from those um, conversations to help propel myself forward as much as I can go.
I think that's a
What's your?
really
Oh, go ahead.
Oh, I was going to say I think that's a really good point about there being a fine line between comparison and motivation. And you can look to others to motivate you, but I think it's maybe more of a mental thing, like you were saying. Like, comparison is when you see what someone's doing and you think about, like, oh, I'm not there yet, I'm not doing enough, I'm not enough, versus, ooh, they're doing that, so I can do that too. And I do you think it's mostly just like that mental shift?
For me, I think that's what it
Yeah.
was. Or like just having a conversation and be like, "Oh, well, that's pretty cool that you're doing that. Like, how'd you get into that? Would you mind
Yeah.
if I asked you more questions? Could we go to
Yeah.
lunch and I buy you lunch or
Yeah.
go for a tea?" And just kind of pick your brain. And I think it's a way for everyone to win.
Yeah.
And what about you? I think it would be interesting for our listeners to hear from your perspective, so as we're recording this, you are almost a year into your
Almost a year.
associateship, and so that I mean almost a year out of residency. So what has time horizon and comparison and that look like for you?
Yeah. I think there's a couple of different pieces of that for me right now. I think there's comparison with my friends and classmates. Where maybe they went into practice right out of dental school and I did a residency. And so it's interesting to see how that played out. Obviously we're big fans of the residency program that we did here, and that's no surprise. But just looking at like the types of procedures and the comfort level and things that I have having done a residency. Obviously there are people, you know, happy doing whatever they're doing or took other CE and we do the same things, but I think that's an interesting frame of reference. I think the other, then there's comparison with my residency co-residents and where we all ended up and, who's doing IV sedation, and I think in those two groups, it's more of a curiosity, not so much a comparison.
Mm-hmm.
In general, I think there are definitely times where you're like, oh, blah, blah, blah. They, they made money for a year more than me. Or, I think it's just interesting to see the skills that we got in residency and what everybody's done with them is really cool. But then the other level of comparison is I'm in a big group practice and I'm the newest, not necessarily the newest doctor at the practice anymore, but I'm the youngest or most recent grad, I guess I should say. And so there is some comparison that I do with like production numbers and number of patients we're seeing and those sort of things. And I'm trying to just use it more as motivation, but there are definitely months where I'm like, I'm not, doing enough or being enough. And just like reminding myself that like they've been doing this at a minimum 2 years longer than you have. Like,
Mm-hmm.
even if you're in the ballpark, like that's great.
I think back to your question that you asked earlier about what changed. And I definitely said mindset, but more than
Yeah.
anything, I started looking at it as an opportunity,
Yeah.
like an untapped opportunity. So, in residency, we learned, IV sedation, and in my associateship, I did that.
Hmm.
In my practice that I own currently, I am not doing it. But it is an opportunity for me to incorporate in the future
Yeah.
back into the office. Yeah, so I think just kind of looking at things as an opportunity, like as you stated about, like, almost looking at the production numbers and that sort of thing. Right now, if you just kind of start looking at missed opportunities that
Yeah.
you have to educate patients on certain stuff, um, and as and when I say miss opportunities, is more so the more continual education you do, the more you practice, the more you know, and the more you can treatment plan, the more you could diagnose. Um, and those are
For
things like you
sure.
said that the doctors who have been out a little bit longer, they've seen more,
Yes.
they've learned a little bit more. So, you know, their, like you said, time horizon is a lot different than where yours is right now. And they're just on a different part of theirs, but you'll get there too. But all of our paths are different.
Yeah. I think the other thing I've been thinking a lot about recently is not compare, but like reflecting back on like my own self. Like, oh my gosh, in dental school, this would have taken me 6 months to do to do this amount of work that I did today. And so looking at those types of quote comparison too of like just how far I've come is trying to focus more on that than like, that shows my own growth within myself versus like comparing two completely different journeys
Mhm.
against, my other coworkers or other colleagues. So I've been trying to look at that more so.
For sure.
How
It's you
okay.
versus you.
Yes. Yes.
Old you versus evolving Savanah.
Yes. How do you go about, you know, setting goals? I think if you don't put a time on them, I think it can just be like a perpetual, "Oh, I'll get there someday." So how do you find one, a realistic time frame in like goals that you're setting now where it's you setting the goals, right? It's not this like
Mhm.
system setting the goals anymore. So that's one. And then how, if you know you're not going to, if you end getting close to that goal and you're not going to meet it, what does that decision look like to you? How do you extend that goal, or what's that sort of thought process to sort of give yourself a little bit of grace there and not beat yourself down of, oh my gosh, I didn't hit this checkpoint by whatever random date I selected.
Mhm. So you and I, we love our books, and so
Hmm.
another book is like the 12-week year. I don't know if you've read that,
I've not, but I'm gonna add that to my list right now.
and it's pretty awesome because it breaks down like if you work towards a goal for 3 months, it seems more achievable than doing it for a year. So you can set your goals for 12 weeks and say in 12 weeks I want XYZ done in whatever aspect of your life, and then
Okay.
just work really hard at it for those 3 months
Uh
and
huh.
see where you get. So, I guess
Huh.
my thought process is I learned to be more specific about what my goals are,
Yeah.
and being more specific whatever that time frame is to do it, if I don't accomplish it, I don't view it as a failure because I'm closer to it than I was had I not started.
Yeah.
And I
That's a
think
really good perspective.
it's more so just been that mentality shift for me, and more so like I think of goals a lot differently. Like I do have long-term goals, but I also have daily goals for myself. I have
Of
weekly
course.
goals for myself. Like my team, they laugh at me because I have like sticky notes everywhere, and then in my phone, like my notes section is like full. Um, but I feel like if you like, I mean, it's a reoccurring thing. I knock stuff off and then stuff goes back
Yeah.
on.
Oh yeah.
Um, but I think it's just the way that I think about it. And like you said, knowing that you're further than you were yesterday or further than you were 2 months ago gives you the grace that you need and the comfort and confidence to keep moving forward.
I think that's really good. I also, when you were talking, was just thinking about like these goals now are not as black and white as I think the goals that we had to get to where we are right now. And so, you know, where there was, you hate to use failure, but like you could fail a test. You know what I mean? Like there was
Mhm.
there was a black and white stop there versus now, like you said, you're just getting closer to achieving it, even if you're not there yet on that time
Yes.
horizon.
Like it's not dentistry related, but we talk about the injury that I have to my back and
Yeah.
how it's frustrating sometimes because it sets me back. But when it comes to just moving my body more,
Yeah.
you know, is it realistic for me to say that 7 days a week I'm going to work out like how I used to? No, like it's a new Ronnetta. So if it means that like I just did 20 minutes of yoga today that's better than me sitting on the couch not doing anything.
Yeah.
Yeah.
I like that. I think that's a great piece to end on, of just, set your goals, but we're all human. We can only do so much.
I know, and I think us as dentists, we haven't gotten as far as we have without setting goals and um being super intentional and persevering to get to this point. And we're not saying don't do that. We're just saying be kind and gentle with yourself and just realize that some progress is better than none, and to keep trying, and we're here for you along your journey. You guys are not alone.
Awesome. Well, that is a wrap on today's episode, and we'll see y'all back here next time.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media, Savanah Craig, BDS, and Dr_Sartor. And remember, you are not alone on this journey.
This episode was sponsored by the Dental Residency Guide and the Beyond Graduation ebooks. These ebooks can be found at ignitedds.com/ebooks.
Thank you so much for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists.